Huntington's disease is a rare inherited brain disorder that causes problems with movement, behavior, and thinking. It's passed down from a parent and occurs when a gene called huntingtin has a genetic error, specifically too many repeats of a CAG segment in its DNA. When this happens, this error damages parts of the brain that control movement, leading to symptoms like uncontrollable, jerky movements in the arms, legs, neck, head, or face, called chorea. Mood changes, depression, or dementia as the disease progresses. Symptoms usually start around age 40, but this can vary depending on how severe the gene error is. People with more CAG repeats often develop symptoms earlier. While movement issues are the first sign, mental health and cognitive decline become more common over time. A 39-year-old man is concerned about his health because his father died at 45 years of age after several years of dementia, uncontrollable twitching, and dance-like movements in his extremities. On further questioning, the patient reports that many members of his family have had similar symptoms. The patient's knowledge of his family history allows the physician to construct a detailed family tree. Seen in the figure, the asterisk represents the patient. What condition is the patient at risk for developing? Huntington disease is characterized by dementia, chorioathetoid movements of the face and extremities, and early death. Huntington disease has an autosomal-dominant inheritance. Other causes of early onset dementia include early onset Alzheimer's disease, multiple sclerosis, HIV infection, or Creutzfeldt-Jakob disease. Multiple sclerosis is a disorder in which the body's immune system attacks the protective covering of the nerve cells in the brain, optic nerve, and spinal cord. Creutzfeldt-Jakob disease is a rare and fatal neurodegenerative condition caused by a proteinaceous infectious agent called a prion. It results in rapidly progressive dementia and death, usually within 1 year from onset. What are the types of Huntington's disease? There are 2 types of Huntington's disease. Adult onset. This is the most common form. Symptoms usually begin after age 30. Early onset, juvenile Huntington's disease, affects children and teenagers. It's very rare. What is the genetic basis of this condition? Huntington disease is a genetic disease that results from increased trinucleotide repeats on chromosome 4. The trinucleotide that repeats is CAG, which codes for glutamine. The gene specifically encodes the huntingtin gene. The exact function of huntingtin is not exactly known. However, when the huntingtin protein is broken down, toxic fragments are created due to the mutant gene. What is the prognosis for this patient? Expansion of trinucleotide repeats over successive generations leads to earlier manifestations of disease in offspring. This is called anticipation. The patient's father died at age 45 years and likely developed Huntington disease many years earlier. If this patient has the genetic mutation, he might already be expected to show symptoms. To date, no disease-modifying treatment is available. Management involves symptomatic treatment and supportive care. On average, Huntington disease leads to death within 15 to 20 years after symptom onset. What neuronal pathology in patients with this condition makes CT imaging useful? Patients with Huntington disease have marked atrophy of the striatum, including the caudate and putamen. Neuronal death in the striatum leads to a decrease in GABAergic inputs from the putamen to the thalamus. Removal of these inhibitory inputs results in increased activity of thalamocortical projections to the motor cortices and causes the coriform movements that are classically seen in Huntington patients. What other conditions often present with similar movement abnormalities? Sydenham chorea in rheumatic fever, tardive dyskinesia, and Wilson disease are among other diseases associated with chorioathetoid movements. What other conditions are associated with trinucleotide repeats? Fragile X syndrome, myotonic dystrophy, and Friedreich ataxia are also associated with trinucleotide repeats. In Fragile X, there is a repeat of CGG on the FMR1 gene on the X chromosome. Myotonic dystrophy has CTG trinucleotide repeat on chromosome 19. Friedreich ataxia is a trinucleotide repeat of GAA on the FXN gene that codes for frataxin. There is a reduction in frataxin causing iron buildup in the mitochondria.